Sarah Dudley, and the first test I'm going to be doing is the flexion, adduction, and axial compression test. So for this one, you're going to put them into flexion, and then adduction, and then put a little axial compression on there. And a positive test would be reproduction of symptoms, and that would indicate labral pathology. Then the next one is the flexion, adduction, internal rotation test. So again, you'll put them into flexion, and then adduction, and then internal rotation. And a positive test would be reproduction of symptoms, and the positive test would indicate labral pathology or impingement. And the next one is the hip scour test. So for this one, you're just going from adduction to abduction, just doing that a couple times. And a positive test would be reproduction of symptoms or pain, and that would indicate labral pathology / impingement / OA. And then the Kendall test, what you're gonna do is you're gonna have both legs kind of hanging off the table, and then you are going to bring one knee up to your stomach, and then extension of this leg would be a positive test, and that would indicate tight hip flexors, specifically the rectus femoris. And then the next one is the Trendelenburg test. So I'm going to have you come stand up right here, facing that way. And then you're going to lift one knee up towards your chest. And if that non-weight bearing hip drops, that indicates a positive test, and that would be a weak gluteus medius, and you'll test that one bilaterally. And then the last one is the piriformis test. So for this one, you're gonna bend one leg and push it over the other one. And for that one, a positive test would be pain, and that would indicate a tight piriformis.
Hi, I'm Brittany DeGraff, and I'll be going over the neuropathology tests and also the sacroiliac joint pathology tests. The first one I will be doing is the femoral nerve traction test. So what you'll want to do is have your patient lay on their side, and then you're going to take this top leg right here, you're going to lift it and flex the knee, and then you're also going to extend the hip. And if there's any reproduction of symptoms like tingling or shooting pain or numbness, that is a positive test. And for this, it is for the femoral nerve. The next test is the straight leg raise test. This one's pretty self-explanatory, but first what you're going to do is you're going to have their legs straight. Oh, and this is testing for neuropathology as well. So you're having their legs straight, and then you're lifting it up. And at any point it hurts or they have a reproduction of symptoms, that's where you stop. And then you'll want to lower it again and dorsiflex their foot. And if they have that reproduction of symptoms again, that's a positive test for neuropathology. The next one is the Valsalva maneuver. So what I will instruct my patient to do is to form a fist with her hand and having no hole or anywhere, and then blow into her hand pretty hard. This is a test for neuropathology, and a positive test is if there's any symptoms that are reproduced. So the next tests are for the SI joint. So first we're going to do sacroiliac compression. What you want to do is find the ASIS, anterior superior iliac spine. Can you lower your leg, please? Sorry. Anterior superior iliac spines on the pelvis. When you locate those, you can go ahead and place your hands and cross them like so. And what you want to do is press down and out, so away from each other. You'll do that, and that will compress the sacroiliac joint. And you're testing for any type of sprain or dysfunction. So if there is pain there, that is a positive test. The next one is the distraction test. So what you want to do is find those ASIS joints again, and then this time you're going to press in, down and in, or just in, and that will distract it'll pull apart the joint. So if there's any pain there or something like that, it's a positive test for dysfunction and sprains. Is the SI screening. So we're testing the sacroiliac joint. So first thing you want to do is you want to find the posterior superior iliac spine. And the way you can do that is first you find the iliac crest. And then you follow it all the way. And once you have found the PSIS, you're going to go through a series of motions. So first I want her to lift her leg up. That's good. Lift the other leg if you can. That's good. So what you're testing here is to see if her PSIS moves up at all or anything that's out of normal range. And if it does, that's a positive test for dysfunction. The next thing I'll have her do is to bend over at the waist. Can you do that one more time? Okay, so her right PSIS went up a little bit, and that's for dysfunction. And then the next thing you want to do is you want to measure the level of her iliac crest and make sure they're the same. So hers seem about right. One next thing you want to do is to see if her PSIS and her ACEs are level. And you just want to find those. And they look a bit right. One is a little higher than the other. However, that can be normal, especially in women. And the last thing you want to do is look at the malleoli, so I'll have her lay on the table. So you're basically wanting to see if one is longer than the other. So I'm gonna have her bend her knees just so she can get that action in and kind of like let them down and relax a little bit. And you're gonna find the medial malleoli and see if one is longer than the other. So her left leg is a bit longer, so that does make a positive test for SI dysfunction.
Hi, I'm Adrienne Crawford, and I'm going to do the other tests, the rib test, and then the cervical and upper thoracic spine test. So the first test we're going to do is a stork standing test. So I'm going to have my patient put her hands on her hips, and then lift one leg. I'm going to be back here just in case she falls over, and then she's going to bend back towards me. And this is testing, you can relax now. And then this is testing for spondylosis, and a positive test would be reproduction of symptoms. Next test is the Hoover test. So I'm gonna have my patient lie down. And I'm gonna feel underneath this leg, and I'm gonna ask her to lift this leg up. And then this is testing for malingering, or basically if she's faking her injury. And the positive test would be no pressure under this leg. If you want to sit up for me. The next test is the lateral rib compression test. This is testing a fracture in the anterior posterior ribs. A positive test would be pain or crepitus. And so how you do this with a broad surface, you come to the lateral ribs and you just compress them, and then if there's any pain, then that would be a positive test or crepitus. And then the next one is the anterior posterior rib compression test. And so kind of how you did for lateral, you would find the anterior posterior ribs, compress a little bit, and a positive test would be pain or crepitus. And this is testing for a fracture on the lateral ribs. Next one is the cervical compression test. This positive test for this would be reproduction of symptoms, and this is testing nerve root pathology. So she's gonna sit up straight, trying to get out, and then you will put an axial load on her cervical spine, and then apply positive test, reproduction of symptoms. Next test is shoulder depression test. So you're gonna push her head to the side this way and then push down on her shoulder. And that is testing for brachial plexus injury, and then a positive test is reproduction of symptoms. And then the next test is the Addison's test, and this is also testing for a brachial plexus injury. So you're gonna take the arm, and then you're gonna find their pulse, and then they're gonna turn their head that way. You're gonna pull their arm back, and a positive test would be diminished pulse or numbness.